I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is ear infections. Ear infections may be the most common childhood illness. I do see them all the time in my office. And I also get a lot of phone calls from parents when their kids are complaining of ear pain, when babies have a fever and they're tugging on their ears, when they're waking up in the middle of the night cranky. Ear infections can cause a lot of pain and distress, not only for the kids, but also for parents. Sleepless nights, missed work. So why do ear infections happen? Well, when your child has a cold or sometimes allergies, fluid accumulates behind the eardrum, and then the fluid gets infected with viruses or bacteria. And this is what causes the ear infection, and it can be very painful. The first and most important thing to do is actually treat your child's pain. So give an appropriate dose of acetaminophen or ibuprofen, because there's no reason that your little one needs to be uncomfortable. The only way to know for sure if your child needs antibiotics is to take your child to the pediatrician's office and have that eardrum examined. There's been a lot of new research done and new guidelines over the last few years on treating ear infections in kids. And basically, do you really need antibiotics? Well, most ear infections will clear up on their own. But if there is a bacterial infection behind your child's eardrum, then you do need antibiotics to treat the ear infection. So let your pediatrician take a look. When your pediatrician looks in the ear, they really need to get a good exam. So don't be surprised if they have to clean some of that wax out of the ear canal, which isn't always comfortable, but very important to really see what's going on. What you're looking for is there a red, bulging eardrum filled with pus or fluid? And in that case, your child may need antibiotics. If it's just red, if there's just a little fluid, if your child doesn't have a fever and it's not really uncomfortable, then your pediatrician may recommend just observing for a few days and giving your child pain medication and re-looking at the ear or having you call and check in with them in 24 to 48 hours. So in older children, especially over age 2, antibiotics are not always the first line. But it is a good idea to keep in touch with your pediatrician and let them know if your child is improving clinically. Are they feeling better? Is the pain going away? Because it may just get better on its own. But if your child isn't getting better, if you have a little baby, if your child has a high fever, if they're really complaining of a lot of pain and discomfort, then always talk to your pediatrician and make sure that your child gets a thorough ear exam, because that's really the best way to know if the ear infection does need to be treated. I'm Dr. Tanya. See you next time on Mommy Calls.